Good evening. My name is Shoshana Seed. I'm a Doctor of Nursing Practice student at Montana State University. I'm currently a registered nurse, and I will be presenting this PowerPoint on positron emission tomography, also known as a PET scan. The goals of this presentation include providing information related to PET scans for mid-level practitioners, demonstration of this test for specific populations, guidelines and expert opinions related to this diagnostic tool, providing evidence for the specificity and sensitivity of this test, and offering personal recommendations for use of this tool in practice. So what is a PET scan? This is a 3D imaging used by nuclear medicine to produce cellular processes occurring inside the body. Usually a radioactive drug, known as a tracer, is injected, sometimes inhaled or swallowed before the exam. This allows for differentiation of healthy and diseased tissue. The most common tracer is FDG. So because PET scans work on the molecular level, they can measure cellular functioning such as glucose metabolism, oxygen consumption, and blood flow. These are used to view and diagnose and monitor tumors, to look at coronary perfusion, to look at the gastrointestinal, endocrine, and neurological areas for disorders. So PET scans are usually coupled with CT or MRI scans that show both the anatomy and the function of the tissue. This is called image fusion. Newer technology allows for a single photon emission CT with computed tomography, as well as a PET CT that are able to perform this imaging simultaneously. And in the works is the development of a PET MRI. So the patient population that this test is used with mainly is oncology patients to determine cancer's progression or remission in these patients. This is specifically important for monitoring cancer because the cancer cells have a faster growth rate than healthy cells, so they absorb the tracer, FDG, more quickly than healthy tissue. And that lights up on the scan and shows you where these tumors are and where the cancer has either spread or if it has remissed. This procedure also evaluates brain tumors, memory disorders such as Alzheimer's, and seizures. In terms of cardiac function, this test can identify cardiac damage from a MI and the need for angioplasty or coronary artery bypass graft due to coronary artery. The specificity and sensitivity of this test ranges with different cancers, disorders, but it does have a high rate in terms of determining malignancies. A meta-analysis conducted in relation to pulmonary nodules revealed the sensitivity and specificity for finding malignancy in these patients were 93.9% and 85.8%, which is pretty high. It's a pretty sensitive test. The test correctly identifies about 94% of people with this malignancy, and that is very great. And correctly identifies about 86% of those who do not have malignancy. This study also revealed that for pulmonary nodules measuring less than 1 centimeter, the specificity significantly decreased. So specificity and sensitivity continued. Another study found the sensitivity and specificity were about 71 and 77% in detecting lymph node metastasis. Individuals with primary breast cancer, this test was 89% accurate. With metastatic breast cancer, it was about 90% accurate. And 9.5% provided a false negative, which means that 9.5% are incorrectly diagnosed with not having cancer when they actually do have cancer. Another study suggested that the PET scan CT integrated imaging has a higher accuracy, sensitivity, and specificity related to detecting malignancies throughout the body. Overall, this test is highly accurate in determining those who do and do not have a malignancy. Some guidelines for PET scans. It's the only non-invasive procedure that can accurately detect tumors in the breast, lymph nodes, bone marrow, lung, with high sensitivity and specificity. There are many guidelines for cancer management that include PET scanning. The guideline for staging non-small cell lung cancer recommends PET scanning when determining metastasis, and this is a level 1B evidence, which is the second highest level of evidence available. Expert opinion has suggested that the PET scan is an invaluable tool for diagnosis, staging, and management of oncology patients. This test can be quite costly, but is considered comparable to CT scanning. And depending on the location of the body where the PET scan is done, depends on the cost. It can range from $1,500 to $12,000, and PET scans on the heart are upwards of $20,000. Recommendations for practice. As mid-level providers, we will probably not be ordering this test for our patients. This is a more specific to oncology. Possibly if you end up specializing in oncology, you'll be working a lot more with PET scans, but this is great general knowledge for practitioners to know what a PET scan is, how it works, and possible implications for PET scan results for our patients. Due to the specific uses of this test, it's not common in practice, but we probably will have a lot of patients who are oncology patients and who may at some point in their lives get a PET scan, and it's good to be knowledgeable about this for them to help with their education, as well as educating them on the implications of this test, and possibly utilizing this test for patients and looking at results with them might be in your future. So it's a very interesting test. I really enjoy how specific and sensitive it is to certain malignancies. It's a great test for cancer patients to monitor their progress and see what's really going on in their bodies in terms of if their cancer has spread or has remissed at all. So this is a wonderful test. It's really interesting how it can be utilized with other tests to create the image with the tissue as well as the cellular functioning. So I really enjoyed my research on this, and it's a great test for oncology patients. So I hope this has been helpful in understanding more about PET scans. It's pretty basic, but I thought it was a fun little project, and here are my references. So thank you very much.